So this is one of the operatories I work in, and you can see it's a general dentistry operatory, and we managed to make it work for doing endo, and we have everything set up. So this is what a setup would look like right before the patient is seated. Everything is still in the sterilized peel pouches. We do not use cassettes in this clinic. I would recommend using cassettes for your instrumentation. It minimizes, actually it's so much more efficient. However, we're still using peel pouches for a lot of the instrumentation. So everything is set up, and then when the patient is seated and we review the consent and the patient's good to go, then we start opening the packages. So here I'll just review. We have a number of, these are number 2, these are the little plates for radiographs. So we already have the PA and the snap array, Mr. Alligator, chomp chomp, ready to go. This is a microscope, and this scope is a global, and it actually connects into the computer in the back. This is like one of my favorite tips, is this bib for endo. I love it. It has a bib that goes over just a plastic bib, and then just a regular bib. I love it. Okay, so just on the dental assistant side of the show, we have our surgical suction for suctioning after endo access, and now we're using hypochlorite just to make sure we're fully sealed. We have our anesthetic, and our topical. So I normally use lidocaine, long and short. Anesthetic syringes. I mean, this is standard stuff we're talking about. These cups are for irrigation, for the irrigants, and I use Q-Mix in this office, and I use EDTA in most other places that I work. So it doesn't, I mean, it depends on what you really believe in. That's all I'm going to say about that. So we have our irrigating syringes sterilized, and we have, these are our ProRents side-ported irrigating needles. And we can bend them to our working length. So I'm going to show you a video on that. I use Cavit in this office to close up the endo access. It's sufficient for a short period of time. I have a great tip on how to place that, get the dental assistant to place it on the end of the instrument, and then boom, in it goes. These are peel pouches. I'm not a huge fan of peel pouches for instrumentation like this. I prefer cassettes because cassettes are much more efficient, and it limits the number of perforations, if any, going through the bag. So this in here is an exam kit. So like an Endo Explorer, perio probe, air water syringe for both dental assistant and dentist, and mirror, and then I think that's what a perio probe. So next to this we have some cotton rolls. I actually use cotton rolls for of all things making cotton pellets, because I find that trying to get cotton pellets out of that little, let me just find one actually while I'm here. This thing, these types of little gadgets, is actually quite frustrating. And quite frankly, we have 3 sets of locking pliers in here, cotton forceps, whatever you want to call them, and then they're always all being used. So to have to kind of access one of these and keep this disinfected, sterile, if you may, is pretty difficult. So what I do is, I'll show a video on this. Just tear it, use it, make my cotton pellet for both consults, and then before I place your restorative material. You can argue that you don't need that and just place calcium hydroxide. I've seen mentors do that, place calcium hydroxide over your obturation, and then that way you don't get those little fibrils coming up through your cavit, and there's a potential source of infection into your brand new, freshly obturated root canal system. So next to that actually is our blockout resin. I use just essentially blockout resin because they have a ton of it for their bleaching trays, so we just use that. You can use Opal Dam, you can use Oraseal. I have a couple videos about that. This is a new high flow BC sealer. I love it, and it's a little more radio opaque. It has zirconia in it. I've been using that for 3 years now. I will not go back to resin or to zinc oxide eugenol. An extra tip. And then we have our endo activator for sonic activation, and then our rubber dam. I don't have it out yet. So we'll come over to my side of the show. In the middle, you'll see we have alcohol and a couple 2x2s. So the alcohol is here because the dental assistant, actually in this office, is Rochelle and Laura. What they do is when I'm using my rotary files, they'll they'll clean the file, they'll hold this, and I'll place the endo file between their thumbs. Well, I'll stop the endo file and play the rotary file, and they'll pull out and clean the flutes, which is critical. Then I look. So once the flutes are clean, I look under the microscope to see if the flutes are clean. I'll show you a video about that to make sure we don't have any unwinding or breakage. And then we continue to clean and shape. In this office, it's great. I love it because we use electric handpieces. So that's this unit here. It's an ADEC. And you have total control over if you've never seen one of these, total control over the speed. So this is both, unfortunately with this setup, there's only one high speed, slow speed, so you have to switch the handpieces, but that's okay. You can control it to 5,000, to 30,000, it maxes out at 40,000, and the torque is unbelievable. And what I'll do sometimes, instead of using a slow round for brushing, or an ultrasonic, what I'll do is I'll slow down I'll put on a number 2 round high-speed burr, and I'll slow it down to 5,000 RPM, and that acts like my Munz burr actually, for troughing. So next you'll see we have gutta percha out. Now what I've learned to make this system really efficient is to pre-select, take a look at the radiograph, kind of have an idea about what size you're going to finish. You can obviously change it on the fly, but I would say 85% of the time it's going to end up with a medium in the Wave 1 Gold system, and I honestly believe for GPs, including myself, that it's a super quick, efficient technique that is safe. The reciprocation, as long as you're within the boundaries, you can be confident that you're going to limit with fracturing. So, and how do you know at the point of fracture? You got to practice. So using extracted teeth. So along with the gutta gauge, along with the gutta percha, brought the endo ice in. Actually, that's a good point. So the one thing I was looking for was the endo ice. So that's here as well for our consults. So that'll be there, sitting there, waiting for me to use. So what we do is we use endo ice to ensure anesthesia. So we do it during the consult, and then if the tooth is vital, say it's symptomatic irreversible pulpitis, what I will do is I'll numb the patient up, provide local anesthesia, and then ensure the patient's confidence that they won't feel any pain. We retest before we initiate treatment. Retest the cold, retest tapping, and make sure 100% that we have total anesthesia of that tooth, because lip numbness does not indicate pulpal anesthesia. So let me say that one more time. That lip numbness does not indicate pulpal anesthesia. All right, enough of that. So here's the gutta percha, and I use a gutta gauge. We're going to talk more about that, why we use it, what it's for. I have a 15 blade that goes along with the use of that. I also have a mouth prop. I love using mouth props. It seems like most people are able to tolerate a mouth prop of this size. I'd say 85% of people in general will tolerate a mouth prop. If it's too large, the adult size, we have one in here. I don't even know if we have. Oh, here's an adult. I honestly compare this to somebody like a horse. It's absolutely humongous. I don't know why it's an adult size, but we usually go for, I think this is a child. And then for other people, the small youth. There's a small youth, excuse me, and it's even smaller. And then we've got there's a whole bunch of different brands and whatnot, different types. So we have those ready at the go. And then we have our Burr Block. So this is a dense ply Burr Block, and what we do is we purchase this up front. It just gets all the burrs. It's a great easy place to hold it, especially in an office where they're not doing endo all the time. And then we just replace the individual burrs. And actually, I think we replace them with just the regular, I think, Henry Schein or Patterson and whatnot. That's what we have in Canada. So it's a little bit cheaper. Like for example, here we go. So refill this. This is the number 4 round friction grip surgical. There's a 10-pack. So we just refill the Burr Block as we go, as we need it. And then we have our endo ring. I swear by the endo ring. In some places, and I really want to show you this, how the dental assistant, you can use them to hold on to the endo ring. And in this office, I hold on to the endo ring, and I love it. So often there's a metal, so you've got your sponge. If you've never seen one of these, there's a sponge. And then you've got your ruler, measuring stick. There's a few other gadgets that attach to it. I don't use it. But what you'll find often is the metal ruler falls off and you're left with just the plastic, because you can see here it's bending. So just be forewarned. And then to keep going here, we're almost done. We have ortho pliers for bending if I need to. I'd say 15% of the time I'll have to place a tiny little J-bend on the end of a file. So I have those ready to go. And on the kind of tool gadgetry side of the house, we have, because I'm doing hydraulic condensation, I just use a simple touch and heat. At this stage of the game, I check to make sure that it is not low battery. Otherwise, I can plug it in right there. There's the charger. Booyah! Because it's always frustrating. So that's one thing to check. It can be never any more frustrating to be cutting through gutta percha and the thing dies. Next is the ProMark. This we use here. In the military, we have the Root ZX2. One of the key things, and I'll show you how to set it up before you get started, but honestly, before the patient gets in the room, check to make sure the battery is good to go, because you can't change the batteries on these. You have to charge it through the wall. So if you're at half or less, charge it, because it's going to give you wonky readings. That's a standard. The beauty of the Root ZX too is I think it's 5 AA batteries, so you can, if the batteries are on the way down, you can just change it out. So then we have our sterilized lip hook and file holder, and then we have the Dentsply old school indestructible box, which I love. It's a great product. I've made the decision to go with the old school box because it's indestructible and it gets put into this cabinet. When everything gets put away, it gets put into this cabinet, and I don't have to worry about it breaking. That's the main reason why I went with this versus any other type of cordless. And then this is the 8-to-1 handpiece that we use. It's sterilized here, and honestly, we lost the little handpiece cradle. Can't find it in this office. I mean, that's just reality. So what I do is they have an intraoral camera, and what I do here is I take this and I lay this across, and then when the handpiece is ready to be used, I place it upside down, and it's actually much more efficient. And the final piece of gadgetry is the microscope. This is a 5-step that I have, and it has an LED light, super bright. I love it. And then I have my high definition video camera that then it's all hooked through the system and comes all around through here and back into the computer. And so